Working as a team is important for quality care because that's how patients experience our care. They never experience care at the Ottawa Hospital from one provider. It's from a whole team of sometimes literally hundreds of people. So you need your whole team working in concert to improve the safety and quality of care for patients.
When we verify the orders and we verify their preoperative assessment, we're ensuring that they're receiving the right care at the right time, and if also their consent, we can ensure they're completed as per our policy, and we ensure that they understand the procedure that's going to be done on that day. We make sure that we answer any questions that they have.
As a social worker, we have the opportunity to be able to engage with patients and really get to know them and find out what their care needs are truly going to be. By doing this, we're helping to ensure that they're receiving the right care at the right place and at the right time.
Well, it's bad enough that patients are already here in the hospital. They don't need to worry about catching anything else or bringing anything home to their family members as well. So it's very important that we keep the infection rate down as much as we can.
Every provider needs to ask the question, would they feel comfortable having their loved one here getting care in this environment? And when we have a system where us as providers feel happy to have their loved ones and family members here in the hospital under our care and not feeling like they need to intervene on that care, then we've achieved, I think, a quality and safe system.
It's important for our team to be efficient because we need to make sure we have the supplies for our patients so they can be seen with whatever they need, and then also for us to make it to their appointments on time. From doing that, it increases all the flow throughout the hospital, and this way we can see more patients.
Well, the big problem we have sometimes, especially with patients, is the fact that sometimes getting them there is not a problem, it's getting them back. And sometimes they've been waiting quite a long time, anywhere from 15 to 45 minutes, and that's not acceptable for myself or for the patient itself. So I usually try to plan my path ahead of time. I try to look at all the areas that might cause me a delay, and I kind of look at the fact that sometimes knowing ahead of the time exactly where my obstacles are going to be or hazards are going to be, or at least where there's going to be a problem of getting the patient there, I try to find the most efficient path possible.
Meal times are the highlight of the day. It's the one time where someone's coming into the room to deliver something that's positive. It's not a needle, it's not any news about a medical condition. It's food, and we all can relate to how important food is. So patients, when our waitresses walk in, you can see them light up. It's really important we have that food there for them on time.
Providing safe care for patients at the Ottawa Hospital requires you to not only do your job, but participate in all the systems we have in place here to enhance patient safety. So those are things like the patient safety learning system, which the principle of that is if you see something that's a near miss event or a mistake that's happening, that you notice it, you report it, and it's the culture of avoiding blaming and shaming people, but bringing out, recognizing deficiencies and correcting them so that it's safer the next time.
When I actually arrive at a patient's room, I usually check to see if there's any obstacles or obstructions or any hazards he might actually have. And I usually try to get those out of the way, or at least have a care provider or a nurse available at the time to help me with that patient. Now, it could be a wet floor that's in the room. There could be something as far as a wheelchair or a commode that may be in the way. I want to make sure that's out of the way for the patient before he actually gets to the stretcher.
It was a patient up on the 7th floor, and I was ready to pick her up for dialysis, and she had no communication in French or English with the PCAs or the nurses, and the nurses was telling me that she's only Portuguese, she only speaks Portuguese, and it's okay. I said I speak Portuguese. So when I introduced myself, I say, "Hi, it's Lucia," and she goes, "Mi não parlare muito francês ou inglês, eu portuguesa." So I said, I am Portuguese. So I explained to her that where we're going, and she was so happy when I saw her. I promised her after every day until she'd been transferred to another hospital that I promised her that I will be there every day. So every day on my break times, I was going to see her.
I like and I love serving people. Because sometimes you just like people, it's not enough, but when you love people, you have a passion and you do your job with more happiness. Like you really care, you're showing that you really care.
It's everybody's quality job, it's everybody's job to be, to give them a good quality.
And I know that most of them, they're very ill, so I try my best to be, to make themselves welcome and also feel better, because it makes it different if you're showing your goodness to them.
So when we call people in their home, we have the opportunity to ask them how we could have improved their hospital experience. And many people will give us feedback that can help us to continually strive to improve the care that we provide to our patients, to their families, and to make sure that this care is carried through after their discharge.
I feel proud of myself when I go home, and I know that I've done my best and provided excellent care to my patients.
And I find that the care that we provide here is exceptional because we actually can and know how to approach a patient, to engage with a patient, to show that compassion, to show that care. That just like your loved one, we provide the best care we possibly can at the time, and finding that this hospital actually does that makes me proud.